Hi, we're with Southern Comfort Marijuana Clinic. Thank you for joining our Weed Talk,
where we talk weed.
My name is Georgia. This is Shelby, and we have Dr. McCain here. And we're just going to go over some different methods of using cannabis.
Hey guys, how are ya? So we're just going to give a brief breakdown on the roots, kind of what's entailed with them, just, their meaning, their onset time, duration time, some of the benefits of using one root as opposed to another, and also just products that come from them. So the first category I think we should probably talk about is the sublingual category. A lot of patients tend to get confused and aren't really sure what this means. And all this means is that you're absorbing your cannabis underneath your tongue and it's entering your bloodstream that way. So some of the products that come from that, which is probably the most common, which is tinctures. A lot of people prefer that route to have an issue with inhaling products or have difficulty swallowing. They also make tablets and like certain sprays that you can put throughout your mouth to consume your cannabis that way. Onset time is roughly 15 to 20 minutes with a duration time of 3 to 4 hours.
So I'm just going to add to that. It was a really great overview of the method of use, what they call sublingual. Sub being under, lingual is your tongue, so just underneath the tongue. And the word tincture, that's a really also easy way to remember. If they call it a tincture, tincture starts with T, tongue starts with T. So I think that's kind of a hint to remember. And there are strategies of use too that make it faster or more efficiently absorbed. So I also advise patients to use like a hot, wet rag and just wash underneath your tongue to get that dead skin off and break those blood vessels. The heat also opens up those blood vessels so the medicine sucks in. I would say that the time can be 5 to 15 minutes, especially for, we'll talk about it later, nano products. If it's 45 minutes, I think that would be, understandable as well for that use. They all come in different flavors. That's another thing, and different types of oils that they use. So sometimes it's just patient preference of what would be better. Every company would use different products in their production. Georgia, what do you think about what patients say about their tinctures?
So there are a lot of patient feedback when it comes to like different flavors, like you mentioned. So there's, berries. Some people prefer the natural ones. I think that tinctures are a great option just because the duration time can be 4 to 6 hours. So if you're looking for something that really is just going to last you longer and could be more financially stable, a tincture is a way to go.
I can second that. So when we talk about maintenance use, if you're trying to control a problem that is most of the day, then something that lasts a longer time in your system is going to be better than trying to just some inhalation, where it only lasts a short time, going from crisis to crisis. So definitely tinctures or anything that's sublingual that lasts a little bit longer are great for controlling a problem. Yes. The other thing I too think the sublingual route in general is good for is because of dosing. So you consistently get the same milligrams each time versus if you ingest something, your metabolism will obviously and what you ate that day could play into it. With tinctures, you have a lot of control about how many milligrams actually you put in your bloodstream because each drop could be 1 milligram. So you always take 4 drops consistently. So when we're talking about using cannabis as medicine, the preparation that's sublingual under the tongue methods are an excellent option.
Yes.
Also, to add on to that, just some of the fine tuning that you can do with tinctures as well when it comes to mixing other products. If you feel like you're just slightly a little bit too high, you can use a CBD tincture, just a tiny bit to bring you back down out of that psychoactivity.
Yeah, easy to blend and find that ratio that's more suitable for you, especially if you're buying, wholesale just THC or wholesale just CBD, that you can make your own tincture preparations a lot easier than trying to bake, your own edibles, for example.
Yes.
Absolutely.
I guess one final thing, and maybe we'll talk about that too. I really just want to make people know that when they sell concentrate or the products that come in the syringe, this is not the same thing as sublingual. We've had a number of patients overdose, so to speak, and not like they're going to have any lasting complications, but an overdose just means you can be pretty miserable for the duration of that medication. So if your tincture comes as really thick goo, it tastes bad, it sticks to your teeth, that's not true tincture, people. That is concentrate. It's super concentrated, so 1 drop could be like 100 milligrams, and we don't want anybody to have negative experiences or have goop that just sticks to your teeth. That's not how you're supposed to use that method.
Absolutely.
that.
Yeah,
Good
for
note.
sure. And then kind of leading into the next route, which would be our oral route. So with the oral route, that just means that you are swallowing it and ingesting it. And products within the oral route are things like lozenges, capsules, sometimes powder that you can mix within your drinks. Those are all really great products to kind of play around with, be discreet with, which a lot of people like the benefit of having that product not smell. Majority of those subliminal products and very discreet products typically fall within this category. Um, Onset time's roughly 30 minutes to, I'd say, an hour, hour and a half, with the duration time varies definitely depending on each patient, but typically within probably the 3 to 6 hour range.
No, I would say that oral medicines are your longest maintenance medication option. So if you're looking for something to kind of really not go from crisis, but just to hold you over, I would say it can happen from like 30 minutes onset to 2 hours, again, depending on how the preparation is made. And then it could last even 10, 12 hours. So this is, for example, a really great use for the person that their trouble sleep is that they can't stay asleep. An oral option will help get through that sleepy time hour. You just take it in advance to know, that it's already kicking in by the time you're actually putting your head on the pillow.
Especially something like a capsule. That's
Yeah,
absolutely.
Yeah,
capsule,
for sure.
yeah. Since we talked about, I ended last note on safety, I'll talk about safety with the oral medicines because this is my disclaimer. If I have somebody come back to us for the first time and who's maybe experimented with cannabis previously, let's say, oh, my friend got me a gummy bear once and I'll never do that again. If I have somebody come back that says that they won't do something, it's because it was probably an edible. So it is kind of an easier way to have one of those overdose events where you feel uncomfortable, and that duration being 10 hours, you can be really uncomfortable for a long time. So just when they come and you get, an edible, whether it's a tablet, a capsule that you can freeze and cut in half, piece of chocolate, maybe cut it into quarters, like really the smallest amount, just so you know that you feel comfortable with it. And there's a lot of other ways that you can take cannabis that are just not affecting your mental status at all, but that goes more into the discussion of the formulations, not so much the methods. I want you to focus with the methods that we're talking about, or the routes that we're talking about, is more think about them for like time frame and preference and how you put it into your body. An oral method is an absolutely fantastic way to medicate because it's kind of just slowing your system and hold steady. You don't have to dose as frequently. And it just does something different to the body. The mind-body experience you get when you're doing other versions, because it is going through your digestive enzymes and everything, it actually converts some of those chemicals to different parts of, cannabis chemicals, hits the receptors differently. So I have a lot of patients that come back and say, cannabis, it saves my life because I can smoke and it takes my edge away. It helps get me to sleep. But when they try an edible, they may come back and say, like, my pain is actually controlled and gone, not just taking the edge off. It hits just the body, or someone who's very anxious, the type of chemistry you get from oral options. And I'll try to not get so geeky. It's a different type of THC. It hits the body differently. So even if you're like an anxious person that gets those chest pressures and stomach and the butterflies, like that's the perfect method of use is the oral method. So I don't want people to get scared. I just want them to be knowledgeable and aware and proceed with caution. And you might actually find it could be one of your best modalities.
Yeah, I will say with any kind of oral method as well, like really truly wait for that onset time to kick in. Like if you take a capsule or an edible, it's been 30 minutes and you don't feel anything, don't take any more. Give it like a good 2 to 3, maybe even 4 hours before you decide to take more medication. It's easier to add more than it is to take away.
Yes.
Absolutely.
Yes, second that, triple that. And also too, it is not actually for everybody. So cannabis in general is absorbed through your fat system. And so you need kind of a working gallbladder to get that method into your bloodstream. Or if you don't want to really do it on an empty stomach, maybe just even we'd say a little cracker. If it's even a little cracker with a little bit of peanut butter, for example, a little bit of a snack will actually make your milligrams feel more effective.
Yep.
Like I mentioned, people with gallbladders may not appreciate the difference. But there's some new technology out there. The formulations are updated. They now can have cannabis in all versions of these preparations that go through the water barrier, so it doesn't matter about that absorption. So so that's what we call that nanotechnology, just means it's water soluble. So every method will probably come in both the old school and updated technology versions.
Yep.
Absolutely. And leading into the edibles portion of that, August 27th, 2020, the state of Florida decided to place edibles in their own category. So it's basically just an extension of the oral category, same onset time, typically same duration time, but these would be more of food-based. So this would be something like your gummies, your chocolates. So for patients who have certain issues when it comes to digestion, the edible route sometimes, may mess you up a little bit. So think about trying a different route and going, maybe with a capsule as opposed to, something like a brownie. Depending on your digestion and how it affects your body, that's something to look out for as well.
And then final note, cost. Let's be honest, like this is a barrier to access of medicine. So edibles do get pricey per each individual unit, but that's something that we can also help educate you on in the future. There's lots of tricks that are just simple recipes where you can make your own chocolates and a little bit of an investment to get that nice mold that just easily pops out pieces of chocolate can save hundreds of dollars in the long run. So that's another, a way to approach cannabis. If it's, unaffordable, there's always ways to change your formulation, get more effective use out of it, changing the methods, and then DIY, do it yourself, make your own oral options.
Yeah. Also, if you have any dietary concerns, some of the dispensaries will have sugar-free edibles, gluten-free edibles, vegan edibles. So if you have any sensitivity or you're diabetic, there are edibles that will work for you.
Yeah, great point. That's why I had brought up about the different flavors in a way with the tinctures, because I know there's some dispensaries that even use like palm oil, and that can really make people's stomach feel queasy or upset. And I would hate for them to say like, oh, edibles or sublinguals just not for me, when it was really that specific company and their ingredients.
Right.
So always just kind of keep that in mind. If something didn't work the first time, it is a lot of trial and error and trying different methods, going outside your boundaries of comfort, because again, no really long lasting complications, even if you do overdose. You feel miserable, but we'll get you back there.
Yeah. Take CBD.
Yeah, take CBD for sure. Leading into our topicals route, this is probably one of the most common forms of cannabis products that are used for pain management. So when you are topically applying something, that just means you're applying it to your skin. You can have products such as balms, lotions, gels that have, that menthol effect, kind of like a biofreeze. They make these patches, transdermal patches that target a little bit deeper into that direct site of pain. And then you actually can increase that area of pain management healing by localizing the area with like a balm and having a patch in the middle. That also helps increase that too. Onset time typically is around 20 minutes, give or take. Definitely varies depending on your pain. And as well as duration time, I'd probably say anywhere 2 to 4 hours. And you just apply them as you need.
And they even have patches that are like 72-hour patches. So if you're a caretaker for someone who's really ill, it's very easy just to put a little patch on there, and then 3 days later put a new patch on there, and it just makes kind of that way of medicating really nice. To be completely honest, I'm surprised at how well topical medications work for patients. I kind of was thinking it'd be like, okay, but sometimes you get really wow responses. But I feel like this method is probably most dispensary dependent. So we have some like dispensaries that everybody loves it, and other ones not so much. So make sure you're asking your offices or your clinics about that kind of heads up advice. Again, from medical perspective, and one thing that's nice too, I guess if anyone has any special concerns that they want to take extra precautions for their personal medical health, liver issues, we would suggest if you have extra concern, if you have a lot of medications, other medications that you take that use the liver for its metabolism, there are ways to use cannabis that skips the liver. So that would not be the ingesting versions, but smoking, under the tongue drops, topical suppositories, all of those methods actually skip going through the liver. So those are like a lot of options to choose from if you have any type of limitation. The other thing too is about how topicals can get pricey. You can make your own. You can always get those tinctures or that syringe I'm talking about, but mix it in with a nice coconut oil or a shea butter. Again, that fat in those specific types of creams, your Everfreight, whatever lotion it is, just a little kind of with that extra oil or extra fat will help it actually penetrate into the skin a little bit better, be more effective, and obviously makes it spread a little further.
Yes. And topicals work great for a lot of our patients that have arthritis for their hands. Really great because you can use it during the day. It's discreet. It doesn't smell like cannabis. So it kind of helps them get through the day.
Not just that too, but patches, going back, because patches, creams, all in that same topical root. People who get migraines because of neck spasms, they'll put a patch on the back of their neck, for example. Ladies who have endometriosis, really bad cramps, you put it on your belly 3 days before a cycle starts, into it, you're good to go. So there's actually a lot of versatility for using cannabis, a lot of different conditions. Yeah, and we didn't even get to the next one. I don't know if you're talking about suppositories.
I know, we're leading into suppositories next, so I guess we'll start there now.
All right, Shelby, you'll go give us that intro.
Yes, so suppositories are going to be administered vaginally or rectally. Onset time, I feel like that definitely varies within the patient, but I would say on average 30 minutes to an hour. Duration time, anywhere, that's kind of hard.
I don't know if I have that feedback or that answer.
Yes. Just from some of the studying I've been doing personally, I read up to duration time being around anywhere from 6 to 12 hours, depending on, I guess, how far internally you would go. So,
it's a pretty long duration time.
I know, that's what I said. I was like shocked when I read that. I'm like, oh my goodness. And leading into some of the products that can be used with that are the rectal suppositories and vaginal suppositories, but some of the benefits are for menstrual pain, GI issues.
Proctitis.
So, I'll take it from here. So it's interesting. We tell patients we're going to, approve them for suppositories, and what's the feedback? I don't worry. You don't have to do that for me.
Yeah.
Listen, I'd rather you have access to medicine so you don't have to ask my permission later is kind of my philosophy, because again, another really great method with very low risk of harms. And so it's actually used for a number of different things, both vaginal and rectal uses. A lot of ladies who have issues with painful sexual activity, for one, even if that includes, I'm sorry, the fact that 1 in 4 ladies have gone through sexual violence or sexual abuse at some point. Sorry, sidetracked on that one, but other menstrual issues as well. But even Parkinson's, a lot of 30% of patients end up having a lot of bladder issues, so it can actually help with that too. And as far as rectal use goes, I use even common examples that might affect everyday people. I've got a gentleman who's a farmer, so he's riding on a tractor. He's got prostatitis, just inflammation of his prostate, and so he actually makes his own suppositories, and he's able to reclaim his farm and get his livelihood back. Crohn's disease, all of those inflammatory bowel diseases, for example, or if you're just at end state and it's hard to keep things down and breathe, just if you could have a better quality of life as we end, I mean, it really can be helpful to treat a lot of those symptoms, things that happen at those stages. And suppositories, it just automatically goes into the bloodstream, really great blood supply, really good onset and duration. It can be a game changer for a lot of people. So don't knock it. I don't know if you necessarily have to try it, but keep it as an option.
Absolutely.
Be open.
Yes, be definitely receptive to trying different roots, because you never know. Your body is just kind of a mystery, I feel like, when it comes.
Changing.
Yes, always ever changing. So cannabis definitely likes to make those changes with you. So definitely switch up your roots every now and then, and see what works for you, or see if you can make it better. And probably leading into our last two categories of roots are smoking flower and inhalation. Now, these only differ within product use. So your smoking flower would be things like whole flower, pre-rolls, ground flower. So when you are using the inhalation route, that would be things like vape cartridges, leading more into your concentrates like your waxes, shatters, rosin, resin. That is basically the main difference between the two, but onset time.
And also I would say, from my medical perspective, would be the difference of smoking and vaping. Smoking is actually at a higher temperature because you're using combustion, like using a flame. So above 300 degrees, I think it's like up to 425 if I recall. Anyways, when
Correct.
you're doing that, you're actually inhaling some tars, which again, if we're trying to go clean, alternatively, vaping is a lower temperature, so you don't get that combustion. You're not inhaling tars. So that's actually kind of like they have electrical vape devices. It's like a convection oven that it warms up the cannabis, not so hot that it actually burns off. So you might actually get more terpenes out of it, and it's actually lower temperature. So it's kind of a healthiest way to use cannabis is vaping it, with the caveat that if you are really concerned about any potential contaminant, of course, the flame is how you can kind of sterilize your cannabis. But hopefully when you're getting it from a dispensary, that is the least of your concerns, the quality or safety of their products, as they should be getting certificate of analysis and prove that they are clean products.
Yes.
And while we're talking about vaping, I think battery options for your vapes are, super beneficial to have. So having batteries that can go super high temps or super low temps, depending on the preference that you like. Most people, when they choose to do their concentrates, that varies within like a 50-degree temperature of preference on what people need to actually activate those certain cannabinoids and, not burning anything off from that point. So there's typically like a 50-degree window within there that people like. So you can find batteries that, are around the 490 range, which is a little bit cooler, or you can find batteries that typically go above that, which you can kind of heat your dabs a little bit hotter as well. So there's definitely some options when it comes to that. So going on to onset time, it's roughly 1 to 5 minutes, I'd say, with a duration time anywhere up to 2 hours.
3 hours, maybe
like max.
Yeah. Agree.
So this is one of those methods that are great for that, like pick up, get me, go, or put me down to sleep. It's just a bad day, the weather particularly bad, I have something going on that's triggering me. So that's the method. This is your crisis control. And I think it's a really easy and good method because it's the same thing every time. You kind of know what to expect. If you don't like it, hey, short amount of time, it'll go away. Easy to use, a little bit, wait 5 minutes, and then you can take another one. Unlike with the orals, we say wait like 3, wait the next day to try taking a second dose. Super, super good option.
I also want to bring up the inhaler, like the actual inhaler looks like an albuterol inhaler, but contains cannabis or CBD, which is great because it works within that 1 to 3 minutes, but it's completely odorless. So if you need to be discreet about using your cannabis, that inhaler would fall under inhalation.
Yeah, just like an albuterol inhaler, which brings me to one point I'd like to make is I have some patients sometimes come, they say, I have asthma, I have COPD, I don't want to do cannabis inhalation. And you don't have to. We've already gone through all the different methods and options. When you have other options that just go under the tongue, straight to the bloodstream, kick in 5 minutes. You don't really need to inhale, but it's a preference. You get different chemistry. So again, I think it's actually a very reasonable thing. Some of our patients who have COPD actually use cannabis because it helps get that cough, get that extra productive mucus out of their system. And actually, there are certain cannabis profiles that have terpenes, and just even THC on itself are bronchodilators. So someone who's maybe having an asthma attack actually can use cannabis to be beneficial. That was actually in the Merck manual, and I have an old Merck manual from the early 1900s, and it has cannabis and how to dose it for asthma.
That's cool.
Wow.
Yeah, like
That's
it used
really
to be
cool.
used as medicine for these causes. So I want to really dispel that I have cannabis. I'm sorry, I have a respiratory illness, so I guess I can't use marijuana. False for multiple reasons.
Yep.
That being said, there was a study that said cannabis can cause lung cancer, 9%. And here's one thing: I mentioned, as when you smoke it, you get a degree of tars. Yes, but there also kind of cancels out with the anti-cancer properties that cancer has. So when they actually repeated that study and took out the cigarette smokers, it did not show an increase of lung cancer. And actually, chronic cannabis users are 1/3 less likely to develop COPD, in addition to diabetes, hypertension, obesity, because it has so many other benefits. Not to say like everyone should go out and start smoking cannabis, but I just always like to, again, dispel some myths about cannabis use for medicinal purposes.
For sure.
Yeah.
Awesome.
That was a really great overview, I think, of a lot of the modalities. And I'm sure we're forgetting some, and there's always more to be said. Patient preference science at this point and technology merging.
Definitely.
Yeah. Well, thanks, guys.
Yes, we appreciate you tuning in, and stay tuned for further educational videos from Southern Comfort Marijuana Clinic.
I'm Dr. McCain from Southern Comfort Marijuana Clinic. We're in Port St. Lucie. You can check out our website at www.socommjclinic.com or just Google Southern Comfort Marijuana Clinic. You'll find us.
Hope to see you guys here.